Well, the relentless coronavirus pandemic put the entire globe on pause, forcing mass lockdowns and event cancellations worldwide. And now, as some of us are emerging from our isolation, health experts worry that a lack of social interaction could have lasting implications. So Dr. Daniel Bober is a psychiatrist and joins us now to discuss the possible side effects of all this social distancing. Doctor, it's funny because I never really considered that maybe we may sort of unlearn our social skills having been unpracticed for so long. But what are some of the potential mental health consequences of quarantine and social distancing?
Well, as human beings, we are wired for social connection. It's part of our survival, just like food, clothing, and shelter. And we yearn for the proximity to be close to others because being close to others we trust provides a sense of safety. And when we don't have that safety, it puts us on a heightened state of alert. It activates our immune system, our endocrine system, our neurological system, and increases the chance that we will develop a mental illness like depression or anxiety, and can even affect our physical health.
So let's talk about the physical health aspect of it, Doctor. Anne-Marie and I were talking earlier in the break about, for example, the fact that we knew that we weren't going to be seeing our friends, our family, we weren't going to be going out, and so we let ourselves go, a lot of us. We ate more than perhaps we should have. We sat around, on the couch when we weren't working, when we were done with our work days, and just watched a lot of Netflix and really, really chilled. And so, now as people start to, either send their kids back to school, or as some workplaces in some parts of the country start to reopen up, you're facing another sort of mental challenge, which is now you've got to sort of get back to your fighting weight, if you know what I mean, to use a term, where you now have to say, I've got to work extra hard to get back to where I was, which can also present some, challenges just mentally as well. So how do people deal with that?
Well, absolutely. It's the perfect storm. We're cooped up at home. We're not interacting with other people. We are using food to cope. We're using all sort of coping skills, which may not be the best. For example, alcohol or cigarettes. And so it's really important to try to maintain a routine and have some kind of structure and really push yourself to get exercise. Even if you have to go outside just to get off the grid and get your heart rate up, it's very important to do that because it's so easy to slide back into that pattern of apathy where you just don't want to do anything, and it takes a toll on your physical and your mental health.
I sort of consider myself like a lone butterfly. Like, I like socializing, I like people, but I'm an only child, and I'm very comfortable with my own company.
Right.
But so for me, this whole thing actually wasn't that bad. It meant that, I didn't have to deal with like unwanted invites to people's houses that I had to figure out, an excuse why I didn't really want to go and all that sort of stuff. So it took a load off of me. But it never occurred really to me that there are some people that really thrive on that social interaction, and particularly talking to parents who have multiple children, and they can see the difference between, their more social child versus their more introverted child. And so, I wonder, there's going to be sort of whole swaths of our society that have been really struggling under this. So it's not just a one-off. Can we talk about the implications of, many, many people just kind of feeling the weight of not being connected, and how long that could affect us moving forward?
Well, we've all seen or probably most of us have seen the Tom Hanks movie Castaway. We remember what happened to Tom Hanks when he was on a deserted island for months and for years. He befriended a soccer ball. So we crave connection so much. We want to attach ourselves to other people. It's just hardwired in our brain. It's our default state. There's obviously a difference between loneliness and solitude. Loneliness is a negative feeling. Solitude is a sense of peace at being alone. But either way, most human beings want to be around other people. There are so many things that happen every day that we think about now that we took for granted. For example, going to the gym or getting a coffee or standing by the water cooler. All these things were social interactions that were seamless. They were just part of our day. And now that they're gone, it's definitely something that we notice.
Yeah, and Dr. Bober and Anne-Marie, the other thing, and it's funny you say that, Anne-Marie, because, you and I have talked about that as well, where my wife Marion said, when this happened, there was one silver lining for me, which is that I could use the moral high ground to reject every single if you want to go to the park, nah. You want to go, right. I would say no to everything because we're on lockdown, and that's how I normally am before COVID. But the other thing that I was thinking of, Doctor and Anne-Marie, is the lack of social interaction, but the fact that people were getting a lot of their information from like social media and not really, the ability to read something, online and then go to work the next day and talk to your friends or talk to your colleagues or talk to your loved ones about, something, and having that sort of collective discussion about something is part of our lives, and instead we often found ourselves in this bubble where we're just like screaming at our computer screens or screaming at our phones or screaming at our television, and I wonder, and because, and this is not anything to do with politics, but because so much of the information we were getting from our politicians and our leaders came from a political viewpoint. In other words, nothing was consistent. You should wear masks. You shouldn't wear masks. You should, open up. You shouldn't open up. And so people don't know what to do, and they yell at their phones and they yell at their screens and they send, nasty tweets to people that they don't like. And I sort of think that might also have an impact on the way we behave and how we feel.
And there's something else to think about too. Going to the gym, going to work, all this is really a social experience, right? It's part of being around people. And digital technology is just a very poor substitute for real human interaction. When you're around someone, you're much more able to read their tone, their mood, the nonverbal cues. When you have to use video to communicate, the message just doesn't get through. We don't recognize faces the same way that we do in person. So it's really a struggle. And after, a bunch of Zoom calls, we find ourselves mentally exhausted at the end of the day because we're trying to interpret this form of human communication, which is totally artificial.
Yeah, I will say one humorous thing to button this up, Dr. and Anne-Marie. I did something that I have never, ever done in my life in the midst of this pandemic. When we decided to go out and take a walk, I actually wore sandals. Not at the beach, not at the pool, but on the streets of New York City, which I would have never done pre-pandemic. It's almost like when George Costanza in Seinfeld, for those who remember Seinfeld, wore sweatpants out, and Jerry said, why don't you just give up? That was sort of my vibe when I wore those sandals and exposed my toes to the world. So, this is what we're dealing with, Doctor.
I think we've all struggled with that.
Yeah, I can
Dr.
second
Daniel
that.
Bober.
My daughter said to me this weekend, isn't this funny how like all we ever do is wear flip-flops now? And I realized that, yeah, indeed, for the past 5 months, we as collectively
totally
as a family, only been wearing flip-flops.
It's so true. So true. We have to laugh, Doctor and Anne-Marie. We have to laugh. If not, there'd be a lot more tears. Dr. Daniel Bober, thank you very much for coming on. We really appreciate it.
See you.